whenever somebody is looking for specs removal, so first of all, he has to fulfill some basic criterias. So it's not like anybody can just walk in to correct their glasses or vision. So they have to be minimum 18 years old, and their spectacle power has to be stable for the last 6 months. Once you fulfill this criteria, then you visit a hospital who's into doing these procedures, and a detailed evaluation of the eye is done. And then it is decided if the laser procedure would suit you better or the lens based procedure, which is ICL, would suit you better. Once somebody is decided for ICL, now it is not that ICLs are ready made lenses. All these lenses are customized, they are tailor made. So when somebody has to get an ICL done, we do all the measurements of the eye, and then we send this data to the company where they custom manufacture this lens and courier it to India in about a week's time. We don't remove anything from the eye, it is only an addition of the lens in the eye. So like cataract, when we are removing a lens and implanting a new lens, in ICL we are not removing anything, there's just a piece of lens which is implanted permanently inside the eye. The procedure is 100% no pain, no injections, no stitches, no hospitalization, no bandage. Both eyes are usually operated together, and there are hardly any pre-operative precautions that you have to take. Simple antibiotic drops, and post-operatively you would have to take about 3 to 5 days of precaution, where we want you to stay in a clean environment, maybe avoid too much of dust and pollution, reduce your screen time, stay indoors, bathe below the neck, and in 5 to 7 days you are nice and fit to start all your routine. So if somebody has to go back to work, get into driving and all those things, that can be started after a week's time. And anything which could be slightly strenuous to the body, like gymming, jogging, running, you want to go into sports, adventure sports, all those activities can be started in a month's time. And usually what we see is that even for the follow-up, we would require the patient to come in hospital twice after the surgery. So the first follow-up is done immediately the next day, and we call the patient after a month's time for the second follow-up, and that is usually how the procedure is done.